I was supposed to be recording for her. Okay.
Oh, for Michelle?
Yes.
Oh.
She got called into work today. Well, it just talks about the see, I'm trying to see where it's talking about the decrease of the osteoclast, because this is talking about the sex hormones inhibiting the osteoclast, and so the bone formation is enhanced and reabsorption is inhibited. I don't see where, I'm trying to see where it says that about the calcitonin. Okay, well, maybe we'll see something about it going forward. All right. An infection, when an infection is blood-borne, the manifestations include which symptoms? When it's in the blood.
Chills.
Okay, and then we would expect the temperature of the body to go up. We would also expect the heart rate to go up, because that's going to go up with the temperature. The majority of bone infections are caused by which organism? Staph, right? Staph kicks our bones ass. Staph. Staph kicks our bones ass. Okay. All right. Next one we're going to is there anything else in this chapter you guys want me to go over? I mean, you did pretty good with it for the most part. We're going to go to 42, which is going to talk about trauma now.
Okay.
I'm just trying to do the book questions with you. I would like to go through some UWorld questions too with you guys, because that really talks about a lot. It gives you a lot of information about the bones in the musculoskeletal section, but I want to go through some of the book stuff with you first, because that's really what you're probably going to be tested on. Your questions probably come right from the book, right?
I saw a lot of pass point in our first exam. I mean, a lot of what's the other ones?
Prep you?
Not prep you.
Saunders?
The extra questions that we get to do now.
Oh,
Canvas.
Oh, okay. It is pass point then, I think.
Oh, that's pass point? Yeah, because I seen pass point too, but how am I having a brain for it? Those extra questions we got to do. I've seen quite a few of those.
On the test?
Mm-hmm. Yep.
Oh, principles?
Principles, yep.
Oh, the principles. Are those on pass point, your principal questions?
They from what I was studying, they were different, but I seen them both on the exam. Pass point and principles.
I think I'm in the wrong book. All right, here we go. Why aren't you working? Okay, can you see it? 42?
Yes.
Okay, this term refers to an injury with ligaments and other soft tissues surrounding a joint.
Is it
Say what again?
a ligament and other? Oh, wait a minute. Surrounding a joint. Subluxation. Yeah.
Sprain. A
It's
sprain is
sprain.
caused by a wrenching or a twisting motion. All right, subluxation refers to a separation or a dislocation of the joint surface. Which term refers to the failure of fragments of a fractured bone to heal together?
Non-union? Not non-union. Not non-union.
Okay, good, non-union. The person's persistent discomfort and movement at the fracture site. Dislocation refers to separation of the joint. Subluxation refers to partial separation or dislocation of the joint. And malunion refers to growth of fragments of a fractured bone in a faulty position, performing an imperfect union. This emergency department nurse teaches clients with sports injuries to remember the acronym PRICE. This acronym stands for which combinations of treatment? Which one?
I think it's A.
Yeah.
Okay, good. It's used for contusion, sprains, and strains. And the circulation problems have to be examined. And then we need to protect, okay? So that we don't injure it any further. We rest it, we elevate it, we use compression like an ACE wrap, and then ice. An X-ray demonstrates a fracture where the bone has splintered in several pieces. Which type of fracture is this?
Comminuted.
Get it up. Watch it up.
All right, comminuted fracture is where it's split, where it's broken into several different pieces, okay? The compound fracture is where damage involves the skin or the mucous membrane, and depressed is where the fragments are driven inward. All right, so splintered into several pieces, comminuted. An X-ray demonstrates a fracture where the bone fragments are driven inward.
Depressed.
Impacted.
Oh, it might be.
I thought that was.
It might be right.
Depressed.
It's
You did
depressed.
say
She
impacted
right.
though, right? You did say impacted. All right. Depressed skull fracture occurs as a result of blunt trauma. A compound fracture involves damage in the skin or mucous membranes. A comminuted fracture where the bone is splintered in several pieces, and impacted is where the bone is driven into another. Isn't that's
Okay.
driven inward? Let's go back to the other one.
Yeah.
Breast fracture is one.
It looks like it is impacted fracture. They might have the wrong answer picked here, because it's not asking us about blunt trauma. Let me go back to your
driven inward. Whenever I see driven inward, then that lets me know.
impacted is what you're thinking about, right? Let's
When
look
I
at
see
it.
driven inward, because from my notes, from what I have, when I see fragments are driven inward, then I know depressed. When I see driven inward.
Okay.
Okay.
When I see for compound, I try to keep it short, but for compound, when I see it involves the skin or the mucous membrane. When I see skin and mucous membrane, then I know it's compound. Yeah. Several pieces, then I know it's comminuted. or I can't pronounce that. Try to keep it not too wordy, but when I see keywords, I'm like, okay.
That's head injuries. That's not even fractures. This is taking me to a part where I don't want to be in. So I'm trying to see. Let's look at comminuted. Maybe I can do it that way. Okay, this is what I have. Comminuted means fracture has more than 2 fragments. So that's that splintering.
Mm-hmm.
And then of course it doesn't, okay, here we go. Let me see if I can make this bigger. Depressed, in which it is driven inward between, got to make it bigger. I can't read it. I don't see one that says blunt trauma. Just looking to see if they have a better description here. Looks like they talk about some more than others. I can't even find the depressed one except under skull fractures. Or in that little section there, which I can't see because they got it so small in the book. What was the other one? Compound.
That one involves the skin or mucous membranes.
Yeah, usually with the compound fracture, you have something sticking out.
Yeah.
It doesn't even bring that up when I do my search. I don't know why. It should. Oh, maybe I'm searching the wrong thing. Oh, it goes back to head injury. All right, we'll have to look at that one also. I want to look at that better. Sometimes I think they do typos in these books, okay, because it says depressed, but when you go back and look at the other answer, it gives you really a bit of confusion there, in my opinion, okay, because it's saying that an impacted fracture is the one that's driven inward. But I would say depressed fracture based on what I just read in the book.
Okay.
All right, a fracture is considered pathological when what happens?
D?
D as in dog, occurs through an area of diseased bone.
Yeah. Pathological. Pathologic. Yeah.
So it's a disease, anything with disease, right? Yeah.
Okay, good. Pathological fractures can occur without the trauma of a fall. So really, a patient could just roll over and get one of these type of fractures. When the client who has experienced trauma to an extremity reports severe burning pain, vasomotor changes, and muscle spasms in the injured extremity, the nurse recognizes that the client is demonstrating signs of what?
Complex regional pain syndrome.
Yeah. Yeah.
Good. Okay, it's frequently chronic and it occurs mostly in women. Avascular necrosis is manifested by pain and limited movement. Pain and decreased function are the prime indicators of a reaction to an internal fixation device. Heterotrophic ossification refers to muscular pain and limited muscular contraction and movement. Which term refers to a fracture where one side is broken and the other is bent?
Green stick.
Green stick, yes. So it reminds you of a stick, right? Sometimes we bend a stick and it breaks, and sometimes we bend it and it just flexes. Which one is often associated with child abuse?
I think it's spiral.
Right. Okay, because that's a twisting around the shaft of the bone.
Mm-hmm.
The nurse assesses subtle personality changes, restlessness, irritability, and confusion in a client with a fracture. The nurse suspects which complication?
Okay. Is it fracture layer fat? Shock?
Fusion. Fusion in a client who has sustained
It's a fat
the
embolism.
fat embolism.
Okay, and what type of clients does this usually happen in? Happens a lot more in male, and it usually happens in what type of fractures? Long bone, okay?
Oh yeah. Yeah.
Okay. Cerebral disturbances in the client with fat embolism include subtle personality changes, restlessness, irritability, and confusion. Compartment syndrome is going to include deep throbbing, unrelenting pain. With hypovolemic shock, we would see a decrease in the blood pressure and an increase in pulse. And then with reflex sympathetic dystrophy syndrome, we would have severe burning pain, local edema, hyperesthesia, muscle spasms, and vasomotor skin changes. That's what it sounded like they just said. Sometimes these people in these books. All right. Cauli's fracture occurs in which area?
Is it elbow? The Cauli's fracture. Hold on.
The radius, the distal. It's the wrist.
Right. The wrist. Radius. You're right.
Okay, so you could call that Cole's. Okay, a Cole's fracture occurs in the distal radius or the wrist. Okay, the Cole's fracture is going to stop me from going to Cole's because my wrist is hurt. I can't pick up those bags. With fractures of the femoral neck, the leg is
It's going to be short and abducted. It should be.
Short and abducted and externally rotated.
so B as in boy.
Mm-hmm.
So it's going to be shortened, turned inward, and externally rotated, or towards the body and externally rotated. Okay, good. Which general nursing measure is used for clients with a fracture reduction?
Encourage ADL.
Yep.
Good. When is it advisable for the nurse to heat a sprain or a contusion?
Wait a minute.
Oh. Immediately.
After 2 days.
72 hours. Okay, 48 to 72.
Apply heat.
I'm
What's
thinking we put ice for the first 2 days and then we switch to heat.
Right.
All right, because after 2 days, swelling is not likely to increase. Oh, I didn't want to do that. Damn it. Hit the wrong button. Okay. In a client with dislocation, the nurse should initially perform a neuro check or assessment a minimum of every 15 minutes until stable. Which complication does the assessment help the nurse monitor for?
Compartment syndrome.
Spread them out so they can dry. Come on, man.
Okay, good. Which term refers to a blunt force injury to soft tissue?
Is that
I don't know why I always,
is it contusion?
It is
yeah.
contusion, okay?
for some reason I always want to mess that one up.
Okay,
I see blunt force contusion. Just relate that.
yes.
Goodness.
I could say something there, maybe I shouldn't. Some blunts cause confusion, but a
Oh,
blunt to the brain will cause a contusion.
boo.
Contusion.
Some blunts cause confusion, but a blunt to a bone causes a contusion.
Contusion. Got it.
All right. Which term refers to a break in the continuity of a bone?
Break.
A break in the continuity of the bone. So we know a subluxation is a partial separation from the joint. A dislocation is usually a complete separation from the joint. So we can eliminate those,
Mhm.
right? So now we have malunion and we have fracture.
So it's fracture.
Good.
Oh,
A fracture is a break in the continuity of the bone,
okay.
okay? And a malunion occurs when the fracture bone heals in a misaligned position.
Misaligned.
So with this, what'll happen is a lot of times is you'll go, you fracture the bone and you go there and they will set the bone and they'll put a cast on it. Sometimes when they put the cast on, the cast is in the wrong position and it actually malaligns the bone. So they have to go back, they have to take that cast off and put a new cast on because the bone's not healing in alignment. And that's why after they do the x-ray, you know, I mean, after they put the cast on, a lot of times they'll bring you back in a week or whatever and re-x-ray it with the cast on, and they're looking to see if it's aligned. Which type of fracture is one in which the skin or mucous membrane extends beyond the fractured bone?
Mucous membrane?
The compound, right? Compound is
okay.
for the skin or the mucous membrane where it extends to the fractured bone. Remember, the compound is going generally, it's going to stick out of the skin when you have a compound fracture.
Right.
A complete fracture involves a break across the entire cross section of the bone. An incomplete fracture involves a break through only part of the cross section, and a simple one does not cause a break in the skin. What are clinical manifestations of a fracture?
Crepitus.
Yeah, correct.
Okay, crepitus. Clinical manifestations of a fracture include crepitus, deformity, pain, shortening, and loss of function. Lengthening is not a clinical manifestation. Which type of fracture occurs when a bone fragment is driven into another bone fragment?
Driven inward.
Now this is driven inward.
It's driven into another bone fragment. It doesn't say driven inward.
Right.
So I'm going to say this is A because we're driving one bone piece into another. It's causing an impact.
Right. Now that's probably it's driven into would be impacted. Yep.
Depressed is driven inward. Impact is driven into.
Okay. Which factor inhibits fracture healing?
I think it's local.
Local malignancy?
Oh, yeah. Inhibits fracture healing.
Okay, factors that inhibit fracture healing include local malignancies, bone loss, and extensive local trauma. That did not just say chapter 1, did it? Let's see. I know I picked 39, but let's see what it says. Okay. Which term refers to mature, compact bone structures that form concentric rings of bone matrix?
Lamellae.
Yeah.
Messing these words up. The one with the L.
Okay. Lamellae are
Yes.
mineralized bone matrices. Endosteum refers to marrow cavity lining of the hollow bone. Trabecula refers to lattice-like bone structure, and cancellous bone refers to the spongy lattice-like bone structures. Which description refers to an osteon?
The microscopic functional bone.
Okay, good. The osteon contains the capillary, microscopic functional bone unit. An osteoblast is a bone forming cell. An osteoclast is a bone reabsorption cell. So that explains more now about the calcitonin, okay, because osteoclast has to do with bone reabsorption. So that's why the calcitonin inhibits the osteoclast, because it's inhibiting the bone's ability to reabsorb, keeping the calcium in the bloodstream. Which term refers to the shaft of the long bone?
Diaphysis.
Okay, diaphysis, the shaft. Which statement describes paresthesia?
Abnormal sensations.
Good. Abnormal sensation. So you're going to have that burning, tingling, numbness. Which term refers to grating or crackling sound or sensation? Crepitus. Which term refers to muscle tension being unchanged with muscle shortening and joint motion?
I think that's the isotonic one.
Okay, that's what I would pick because it says without change. Stays the same. Usually that's what isotonic means. Which stage or phase of bone healing after a fracture does callus formation occur?
Callus formation. Reparative.
Okay, callus formation occurs during the reparative stage, but it's disrupted by excessive motion at the site. Remodeling is the final stage of fracture repair. The new bone is reorganized into the bone's previous structural arrangement, and during inflammation, the macrophages invade and debride the area. Revascularization occurs about 5 days after the fracture. After a fracture, during which stage or phase of bone healing is devitalized tissue removed and new bone reorganized?
Is that remodeling?
Remodeling is the final stage of fracture repair. During inflammation, the macrophages invade and debride. Revascularization occurs in 5 days after the fracture, and callus forms during the reparative stage.
Can you go back to the question for a minute? Okay, thank you.
Which nerve is assessed when the nurse asks the client to spread all the fingers?
The ulnar.
Okay, the ulnar nerve is assessed when the client is asked to spread all the fingers. This allows the nurse to assess motor function, while pricking at the fat pad on the top of the small finger allows assessment of sensory function affected by the ulnar nerve. The peroneal nerve is assessed by asking the client to dorsiflex the ankle and extend the toes. Radial nerve is assessed by asking the client to stretch out the thumb, then the wrist, and then the fingers at the metacarpal joints. The median nerve is assessed by asking the client to touch the thumb to the little finger. Which nerve is being assessed when the nurse asks the client to dorsiflex the ankle and extend the toes?
That's the perineal, right?
The peroneal nerve is assessed when the client is asked to dorsiflex the ankle and extend the toes, while pricking the skin between the great toe and the center toe assesses sensory function. The radial nerve is assessed by asking the client to stretch out the thumb and then the wrist and then the fingers at the metacarpal joints. Median nerve is assessed by asking the client to touch the thumb to the little finger. Asking the client to spread all fingers allows the nurse to assess the motor function affected by the ulnar innervation. Which statement reflects the progress of bone healing?
Serial X-rays are used to monitor the progress of bone healing.
Serial X-rays are used to monitor the progress of bone healing. This type of bone fractured, the adequacy of blood, the type of bone fractured, the adequacy of the blood supply, the surface contact of the fragments, and the general health of the client influence the rate of fracture healing. Adequate immobilization is essential until X-rays show evidence of bone formation with ossification. A client is exhibiting a diminished range of motion. Loss of flexibility, stiffness, and loss of height. History and physical findings are associated with age-related changes in which area?
Loss of flexibility, stiffness, loss of height.
So the joints.
Yeah, the joints.
History and physical findings associated with age-related changes of the joints include diminished range of motion, loss of flexibility, stiffness, and loss of height. History and physical findings associated with age-related changes of bone include loss of height, posture changes, kyphosis, flexion of the hip, knees, back pain, osteoporosis, and fracture. History and physical associated changes with muscles include loss of strength, diminished agility, decreased endurance, and a prolonged response time. Diminished tone, a broad base of support, and history of falls. History and physical findings associated with age-related changes of ligaments include joint pain on motion that resolves with rest, crepitus, joint swelling, enlargement, and degenerative joint disease. Fracture healing occurs in 4 areas, including what?
Is it the external soft to include external soft tissue? Fracture healing occurs in 4 areas. The bursa, the cartilage, fascia.
The soft tissue.
External soft tissue. Okay, so the bone marrow, the cortex, the periosteum, and the external soft tissue. Which is an indicator of neurovascular compromise.
Diminished pain.
Cap refill.
Longer than 2 seconds.
Cap refill?
Mm-hmm.
Good. Which term refers to moving away from the midline?
Abduction, right? Abduction, moving away from the midline. It's abduction.
Oh, I picked the wrong one.
Mm.
Okay. I know it's abduction because that's taken away, right? We kidnap somebody, we take them away.
Okay.
All right. So now we're going to pick the right one this time. What is the term for lateral curving of the spine?
Lateral, lordosis, lateral. Hmm. It's therapy, but I have to go with one. It's LLL, lordosis, I think.
So you think it's lordosis?
The lateral, because with lordosis, that's the lumbar.
Okay, lordosis, so it's lumbar. So scoliosis is
Right.
lateral.
Right.
Okay, good. What is the term for a rhythmic contraction of a muscle?
It's clonus, right?
Yeah, that's clonus.
Okay, good. What is a circulatory indicator of peripheral neurovascular dysfunction?
Peripheral. I think that's the cool skin. Peripheral neurovascular dysfunction.
That's right.
Yeah.
Okay, indicators of peripheral neurovascular dysfunction related to circulation include pale, cyanotic, or mottled skin with a cool temperature. The cap refills more than 3 seconds. Weakness, paralysis are related to motion. Paresthesia is related to sensation. An example of a flat bone.
Sternum.
Yeah. They locked that door.
Okay, good. Short bone is a metacarpal, femur is long, and vertebrae is irregular.
Chapter 39.
Yep, that was 39. The next one should be 40.
Okay.
Which device is specifically to support and immobilize a body part in a desired position?
The splint.
To a desired
Yep, a splint. That's going to help us keep it, straight.
straight.
Trapeze we use to help get out of bed, and I forgot what the other one was there. The nurse teaches the client which intervention to avoid hip dislocation after replacement surgery.
Never cross the affected leg when seated, right?
Correct. The nurse teaches the client with the cast about home care, which includes which instruction?
Is a dry, a wet fiberglass cast. It's B.
Okay, good. Which benefit of a continuous passive motion device, which is a benefit of a continuous passive motion device when used?
Is it B? It promotes healing by increasing circulation and movement to the knee joint.
Yeah, I think I would go with B.
Okay, good. Which nursing action would help prevent a DVT?
Had to be B. Apply anti-embolism stuff. Okay. Oh no, exercise instruct kind by exercise.
Well, usually the
gotta
exercise we're
move,
doing
right?
to strengthen the knee. With the DVT, we're doing the embolism stockings and we're ambulating early. We're increasing fluids, those types of things, because that's for the blood clot. But the exercise is going to be more about the range of motion, in my opinion.
So it's gonna be B, and the embolum, the SCD stocking.
Okay, so the muscles, the range of motion is for the muscle strength and the tone and to prevent the contractions. Which type of cast encloses the trunk and a lower extremity?
The hip speaker or spica.
The spica, the hip spica?
Yes.
Okay, good. Which statement is accurate regarding care of a plaster cast? You can just eliminate what you know is not true.
It can be dented while it's damp.
It can be?
You can get a dent in it.
Okay, so a dry plaster cast is white and shiny. It will dry in 24 to 72 hours. A freshly applied cast should be exposed to circulating air to dry and not covered. Which would be an inappropriate initial pain relief measure for the client with the cast? Inappropriate initial pain relief measure.
Inappropriate.
Application of a new cast.
Okay, because we might have to either decrease that swelling. We might even have to like put a little cut in the side of that cast, like a little split in it, right? If the person's having pain relief, to try to, so we can decrease the risk for that compartment syndrome. Sometimes we might have to put a new bigger cast on, but usually they'll split it first. All right, which would be contraindicated as a component of self-care activities for the client with a cast?
Cover the cast with plastic.
To insulate it. Okay.
You don't want to cover it.
The only time we're going to put plastic on it is when we're showering. All right. And I prefer press and seal. Which is an inaccurate principle of traction?
A, skeletal traction is interrupted to turn and reposition the patient. You're not supposed to interrupt it.
Mm-mm.
Okay. Which term describes a surgical procedure to release constricting muscle fascia so as to relieve muscle tissue pressure?
Fasciotomy, right?
Yeah. Yep.
Which cleansing solution is the most effective for use in completing pin care site?
Chlorhexidine.
That's our favorite cleanser period for everything just about now. All right, which orthopedic surgery is done to correct and align a fracture after a surgical dissection and exposure of the fracture?
Is it total joint arthroplasty?
I think that's the open one.
Okay, so, or is it open? All right, total. It says what? So is it an open reduction? I thought it was A, but oh, there you go.
Open reduction is correction and alignment of the fracture after surgical dissection and exposure of the fracture. Arthrodesis is immobilizing the fusion of a joint. A joint arthroplasty or replacement is replacement of the joint surface with metal or synthetic material. And a total joint arthroplasty is a replacement of both the articular surface within a joint with metal or synthetic plastic. Which is an inappropriate use of traction?
I think it's the decreased
Yeah.
opposing structures.
Okay, traction is done to increase the space between opposing surfaces. Traction also helps minimize muscle spasms, reduce, align, and immobilize fractures, and reduce deformities. Meniscectomy refers to meniscectomy.
It's going to be a removal or something. Removal of a body part.
Yeah, excision of damaged joint. Fiber cartilage.
Which one is it? Oh, A.
Excision. Yeah.
Okay.
Which one?
A.
Excision of a damaged joint.
Yeah.
Most commonly the knee. Which device is specifically designed to support and immobilize a body part in a desired position?
And it just
We did this one already.
Splint.
Is that splint?
Which principle applies to the client in traction? I guess we're going with that one again, huh?
Oh yeah, we did it.
Similar one we did, not exact one.
Gotcha.
All right. Which intervention should the nurse implement as part of the initial plan of pain relief for the client with the cast? Select all that apply. Pain relief.
Apply cold packs. Administer analgesics. Provide passive range of motion. And you want to elevate, right? If you disagree, it's incorrect.
No passive range of
Oh,
motion.
no passive. It's just
okay. First of all, you might not even be able to do passive range of motion if they have a cast on. To, you know, you're not going to be able to move that part, but which would be considered a component of self-care activity for a client with the cast?
You mean cushion the rough edges of the cast. Yeah.
Nothing else makes sense, okay? And as Judge Judy would say, if it doesn't make sense, it's not true.
What's that?
Which action by the nurse demonstrates an understanding of caring for a client in traction? Select all that apply.
I guess they want to hang freely.
Okay.
Okay.
Assess the client's alignment.
Mm-hmm.
Okay.
See?
Assess the pain.
They supposed to have a trapeze over the
Give
bed,
them a
right?
trapeze so they can swing from the chandeliers.
Mm-hmm. I don't think we want to do E.
Because we're not interrupted.
That's
Okay.
right.
Good. Okay, testicles must, weights must hang freely. The client has to be in good alignment. And we have to monitor for pain.
So you a mess.
I know, but you remember that way, see?
Yes, I'll be in the testing center thinking about you.
You'll be like, oh yeah, the testicles gotta hang freely. See, if you have funny stuff to associate it with, it works better.
Yeah.
And then also it kind of helps you laugh in that exam. All right, I want to see if I can get into UWorld because I want to just go through some musculoskeletal questions with you guys on that. I would keep working on these questions in the book and also keep doing your challenging yourself. You know, if you have access to additional practice questions in PassPoint and in PrepU.
So can you do me a favor? My principles, I had the app downloaded. I don't know if it kicked me out
Okay.
or what, but I'm gonna need to get back in. Usually you need like a pass, a code or something to get back in. I forget the young lady that will send. I just need to get back in the principles. I don't know how I'm gonna get back in there.
So you need your password reset. You're locked out.
Yes, I am locked out.
Okay. Let me see if UWorld's going to let me in on this computer. I don't know why it's not. It's really acting funky. If not, I'm going to log into Zoom on my other computer because I really want to go through some of these questions with you guys.
Oh my God, it's 11:30 already.
I know. The time goes fast when I'm doing tutoring. But the people that I usually do on Saturday mornings, like they didn't show up this morning and the one person said she's working today. So if she's working every Saturday, then I might be able to extend you guys a little bit longer if other people aren't going to come in. So that's what I have to see. All right, let me see if I can get into Zoom here on this other computer.
Also, technically next Saturday, the next 2 Saturdays technically will be on break, but I'm still willing to come on. Are you still tutoring, or we won't be tutoring again until school's back in session after the year?
So I'm waiting on my grandson to call me because what I have to figure out is what Saturday they're going to come for Christmas.
Okay.
Okay.
If they don't come next Saturday, then we can do that Saturday. If they do come on Saturday, then we could set it up either for Sunday maybe or for Friday or something.
Okay.
Okay.
And also it's going to depend on, you know, how many games I got to go through to go get them. So if I have to go pick my granddaughter up, that makes a difference. You know, they like to play games with the grandbabies. So dumbasses. I can't with dumbass people. Why would you do that to somebody if you have somebody that loves your kids?
Right.
First of all, when my in-laws want to take my kids, I'd be like, yeah,
Right?
keep them for about a month and then bring them back. Because if you know somebody's not going to hurt them or something, that just doesn't make sense.
Right.
But whatever. I've been going through it for 19 years. I guess a couple more ain't going to make a difference.
Oh, wow. Damn.
Okay, let's see. All right, did that get rid of the echo? Good. Can you still hear me?
Yep.
Okay. Where'd you go, you world? All right, can you see my U world screen?
Yes.
Blah, blah, blah. You guys doing anything else besides musculoskeletal, neuro, anything like that? Alert, you're doing immunity, right?
Yeah, we doing immunity.
So it's
Muscular.
mostly musculoskeletal, immunity, and oncologic I have, right?
Yeah, that's, yes, we doing those.
Okay. So, you know, when you read about the different disease processes, what you need to do, and you think about these, is think about like, what do I know about this disease process? So like rheumatoid arthritis, you know, it's an autoimmune disease process, right? There are certain drugs that you might have to take like methotrexate and stuff like that because you have this chronic inflammation of these joints, right? And where does that inflammation occur in the joints? What are some other things that you can teach the patient about that disease process so that they can help themselves in other ways besides just medications? All right, because that's not your ultimate course of treatment. That's just what we use when everything else that we've already tried to do has failed. So when you're asking yourself about the questions, especially doing practice questions, you want to try to make yourself brainstorm before you answer the question so that you can keep your brain fresh. When you do this brainstorming and you try to think about 5 or 6 things about this disease process or the causes of it, then when you see a test question, number one, if it's a select all that apply, now you already know at least 6 or 7 things about this disease process that might help you answer those questions. Plus, it helps you understand the disease process better when you start getting to those critical thinking questions. So this is a negative inference. It's asking which of the client statements indicate a need for further teaching. So which one of these statements is wrong regarding the patient's education about rheumatoid arthritis, home care, and symptom management? So which one of these would you not encourage the patient to do? All right, so daily range of motion exercises are important to keep my joints flexible. True or false?
That's true.
Okay, I can use a moist heat pack to help with joint stiffness. True or false? It might work. You know, they might be able to use some moist heat or a warm bath in the morning before they get up and try to move around or exercise to help ease the joint stiffness and some of the circulation. How about I should elevate my knees with pillows when I'm sleeping?
I don't think you should do that one.
So I really don't like that answer choice because I feel like that could precipitate other issues, or
Contraction.
make the knees stiff if you keep them in a same position the entire time. I will make sure to rest between activities throughout the day. With someone with an autoimmune disorder, would we want to do that?
You want them to rest.
Sure, you want them to cluster like activities together so that they can do, in the most energetic times of the day, those small bits of activities and then rest in between. So which one? There's really only one that makes sense here for me. And I could be wrong on these questions. I'm not always right. So you pick the ones that you like.
I
I'm
don't
gonna go
like
with
3.
three.
Yeah.
Yeah.
Okay, now here's the 6 things that you would want to know about rheumatoid arthritis. It's an autoimmune disorder characterized by inflammation and damage to the synovial joints. It causes progressive fibrosis of the joint membranes, and that is what leads to the pain, the deformity, and the stiffness, is that fibrosis of the joint membranes. Over time, remodeling of the joint capsules and the associated pain reduce that patient's ability to perform activities of daily living. Simple things like toileting, bathing, dressing, even things like just walking or opening a door. So in order for them to maximize their ability to function and their quality of life, okay, you want to teach them about ways that they can manage that pain and manage that stiffness. So we're going to teach them gentle range of motion exercises to perform daily. That's going to help them keep those joints flexible. We're going to apply moist heat to those stiff joints and ice to the painful joints. We're going to give frequent rest periods to reduce fatigue and inflammation of the affected joints during the activities. And then we want to teach them to sleep and rest in a flat, neutral position. Body alignment devices or immobilizers might be used to keep the joint straight. But we don't want that prolonged flexion of the joint, like elevating those knees on the pillow, because that could cause a contracture or decline of the joint function. All right, so you see a lot of good information there, and this falls under physiological adaptation under your NCSBN, which you'll see when you get to the senior seminar. The nurse reinforces teaching to a client with systemic lupus erythematous. Which instructions would the nurse include?
Oh, 2.
Okay, 2, avoid situations that cause physical and emotional distress because they can cause exacerbation of this autoimmune disease of the what?
The immune system.
Connective tissue, I think it is. Is this a connective tissue disorder?
Oh yeah, lupus. Avoid sun exposure and ultraviolet light when possible. Yeah. They want to stay out the sun. They don't use no antibiotic soap to clean those skin rashes. Now, if you have a fever, what? I'm not sure
So
about.
that would apply if you felt like the person was at high risk for infection or if they're immunosuppressed. So if this causes immunosuppression or if the drugs used to treat it cause immunosuppression, then that would be a concern.
So then it's only the 2 then. If I know.
Okay, it's an autoimmune disorder that causes inflammation and damage to the body parts. The symptoms can vary widely, but they're going to have these painful swollen joints, extreme fatigue, skin rashes, kidney problems. Okay, they'll have these flares or exacerbations. There's no cure, but it is treated with immunosuppressants. So again, when your patient is going to be on these immunosuppressants, you do have to notify the physician. Why?
Because fever can mean.
Yeah, a slight change in body temperature for these patients can indicate an infection, and they might not be able to fight it as well as someone else because they're immunosuppressed.
Gotcha.
Stress can exacerbate it. Sunlight can make the rash worse. The nurse has provided education for a client with a newly diagnosed ankylosing spondylitis. Which client statements indicate a correct understanding of teaching? So first of all, what is it? Ankylosing spondylitis.
Wait, my son is vacuuming. I'm trying to wait for him to finish, or I'm either going to go upstairs. So.
All right. So you don't want to sleep on it. It's It's inflammation of the joint somewhere. So is it
So again, it's
spot
an
two?
disorder, and it's going to cause inflammation in the joints of the spine, causing chronic back pain and stiffness.
Right.
Okay. So do you think you should continue strenuous exercise during flare-ups?
I wouldn't do strenuous exercise.
Exactly. So that's a no. I should include spine stretching activities such as swimming.
Spine stretching. Swimming is good, but spine stretching,
and that might work. That, I mean, it doesn't sound unreasonable.
Right.
Okay. I haven't heard of it before, but to me, it doesn't sound unreasonable. So I might pick that.
Okay.
How about quit smoking and perform breathing exercises?
I like that one.
And I mean, hey, if you're wrong now, then you learned something. I will sleep on a soft mattress to decrease my morning stiffness.
No, you want to sleep on a firm mattress.
I will take the prescribed ibuprofen on an empty stomach.
No, you want to take that with food.
Okay. So a little common sense goes a long way, guys.
Yeah.
All right, so there's your spondylosis or spondylitis. Okay. So no known cause or cure, characterized by stiffness, fusion of the axial joints like the spine or the sacroiliac, causing restricted spinal movement, low back pain, morning stiffness in a place we don't like it, that improve with activity, all right, involving the thoracic spine, the costosternal junctions. This can limit the chest wall expansion, so that's why the breathing exercises and the stopping of smoking. So swimming and racket sports like tennis, handball, that type of stuff would, or it's not handball, but they use racquetball. Then stop smoking, the breathing exercises, moist heat, NSAIDs. These patients are also going to be on immunosuppressants and anti-inflammatories. So rest, sleeping on their backs on a firm mattress. The nurse reviews the serum lab results of a client who was seen in the clinic 2 days ago for worsening joint pain, flare of systemic lupus erythematosus. Which result is of greatest concern and prompts the nurse to notify the healthcare provider?
Okay, so worsening. So inflammation is the biggest thing with them, but a white blood cell count.
Elevated
White cell.
erythrocyte sedimentation rate. If that's elevated,
that means they got some inflammation going on, right?
So would you expect that to be elevated in this person?
Well, it should be elevated.
Yeah.
Okay.
Okay.
So what you want to think about is which one of these is most critical. Okay. So what should my normal creatinine be? Because these patients have kidney issues, right?
Mm-hmm.
Normal creatinine is what?
It's 2 point something, 2.34 something.
It
I
shouldn't be
think
like
it's
no more than
0.5 to 1.2, right?
yeah. So that's a
It's-
little high.
So it's high.
Elevated.
Okay. Elevated urethrocyte sedimentation rate. Do these patients all have this?
It's going to be elevated because they have
What about the anti-nuclear antibody titer? Would they have a positive one of those?
yes.
Okay. And what about a white blood cell count of 3,600? Is that high or low, or would we expect that?
That's low.
Yes. Well.
But that's low.
So which one would make us most concerned?
Well, kidneys ain't working, but
And
but
risk
then
for
you don't have
infection.
you risk for what?
with the low white blood count.
Yeah, because you have nothing fighting, but you got an infection if it's high. This one I'm stuck on.
So between 1 and 4.
Yeah, there you go.
Well, let's see which one is the most off.
So
One is
creatinine.
elimination. So if that creatinine is too high, that would fall under the first stage of Maslow's. 4 would be infection. How immunosuppressed would I expect this person to be if they're on the treatment for this? Because they're going to be on steroids and stuff like that. So that's what you have to think about.
Okay, so I
Let's
think
just
it's
pick 1 and see.
Yeah. Yeah.
Now that we just went with that simple Maslow's there, and it brought us to the right answer, right? Okay, so we have this autoimmune disorder, all right, with this chronic inflammation. It can be from mild to severe. Remember, it affects the kidneys, the heart, the lung, the blood vessels. Increased creatinine, 0.6 to 1.3. So we have increased BUN. This is abnormal urinalysis, and this can indicate the presence of lupus nephritis, which is a serious complication. So we're getting this irreversible kidney damage developing, okay? We would expect the elevation of the urethrocyte sedimentation rate to be greater than 30, okay? But all that tells us is that we have inflammation in the body. It doesn't tell us about anything about the organs or the damage that it's doing. So this can happen with anybody that has inflammation in the body. The ANA delegates the presence of that possible autoimmune disorder. Okay. And then with the white blood cell count, we would expect to be somewhat down. It's not critical at 3,600, since our levels, we would expect to be somewhere between 4,000 and 10,000.
Oh, okay.
Or 4,000 and 11,000, whatever, numbers you want to go with there. The nurse assesses the client 5 minutes after initiating a blood transfusion. The client has shortness of breath, itching, and chills. The nurse immediately turns off the transfusion, disconnects the tubing at the catheter hub. What action does the nurse take next?
Check the vital signs.
Check vital signs? Oh. Maintain IV. Make sure that line is open.
All right, so we have signs of a transfusion reaction. We need to include chills, fever, low back pain, flushing, and itching when we're thinking about that
transfusion reaction, okay? We're going to stop the transfusion immediately, disconnect the tubing. Where does that tubing go that we just disconnected? To the blood bank, okay? It's going with everything else to the blood bank. Maintain IV access with normal saline using new tubing. That's going to help prevent hypotension and vascular collapse. And we might have to give the patient something. So we want to make sure we're maintaining that access. Then we're going to notify the healthcare provider and the blood bank. We're going to monitor the vital signs. We got to go back. We got to recheck those labels, those numbers, the blood type. We got to treat the client's symptoms, collect blood and urine specimens, and so on and so forth, okay? I know you guys aren't really doing IV access now, but that one popped up in here because I picked oncology, and hematology is automatically with that. All right, nurse provides discharge teaching to a client who had a total knee replacement 4 days ago. Which client statement indicates a need for additional teaching for a total knee replacement? I have to give my shots in the belly because my spouse is afraid of needles. I have to use a walker because I can't bear any weight on this knee yet. I will call my healthcare provider if I get short of breath, sore, or swollen below my knee. The raised toilet seat makes it easier for me to get off and on the toilet.
Okay,
The
so
statement is wrong.
additional teaching.
Would it be 2?
Yeah, because what is true about this? First of all, if he's non-weight bearing, can he use a walker?
Mm-mm.
So it's an oxymoron there, right?
Mm.
Unless he's going to be hopping on one leg. All right, so average stay 3 to 5 days. And some of them are same day. Isometric quadriceps. Okay, on the first day, the patient should be fully weight bearing by discharge. An elderly client with osteoporosis falls onto an outstretched hand and injures the wrist. The client has severe wrist edema, deformity, and pain on a 10, and a pain rated of 10 on a pain scale of 0 to 10. What should be the nurse's first action?
Assess cap refill, sensation.
So the pain is a 10. The pain, what did I say? Yeah, deformity of pain is a 10. Okay. I want to make sure I was reading that right. First action.
Because of the deformity, you want to make sure she got perfusion. I don't know. And so you want to assess cap refill to make sure she got sensation. Maybe don't sound right.
Well, it's the only one that's different. And generally we do assess first. You also have to think about physical versus psychosocial. So pain is really a psychosocial.
Mm-hmm.
Gotcha.
Doesn't mean it's not always not the right answer. I do like 3 over the other options.
So I see what you're saying. So so it's either 2 or 3, but it's 3.
Okay, so we have this Cauli's fracture. Remember, that's that wrist distal radius fracture.
Mhm.
All right, so we're doing the neurovascular check. That's your priority. Analgesia to promote comfort, then the ice pack, elevate that extremity, and teach the client to move those fingers for the range of motion. All right, last one here, guys.
Okay.
The nurse is caring for a client 12 hours post-op total hip replacement. Which nursing intervention is appropriate to help prevent dislocation of the hip prosthesis? So again, just read them out and see which ones make sense. So we're not going to tell them to cross their legs, right?
Uh-uh.
All right. What about maintaining the head of the bed at greater than a 60 to 90 degree angle?
They shouldn't be more than 60 degrees, not 60 to 90, right?
Okay, we're putting that abductor pillow because when we abduct, we take the leg away between the legs when we turn the client, or turning the client to the affected side to alleviate lateral muscle pulling.
Actually, 2 might be the better one because you're not going to turn to the affected side. You turn to the unaffected side. And you place an abductor pillow between the legs, not when turning, when they laying, right? You don't have the abductor when you turning the patient. You move it and so
Well,
it
I
is
think we
maintaining
keep
a
the
bed.
abductor pillow pretty muchly there all the time, right?
Mm-hmm.
Whether we're turning them or not.
Oh, okay. So I see. Oh, so we leave it there, and then log roller. Nah, well, you could push them. I'm trying to figure this one out. Instructing client across the legs. No. Place an abductor pillow between the legs when turning the client. Turning the client to the no. 1
So
and
take
4
out
is
the
out.
ones you really don't like first, and then go back to the ones that you do like. So you know we can eliminate 1,
Right.
and you don't like 4.
Right. Gone.
Now you've heard of 3, at least something about 3.
Right.
Mm-hmm.
What do you know about 2?
You're supposed to keep that head up. It might be greater than 6. I know it says 60, but it says 60 to 90 degrees. I know you want the head higher than the hips, or the
I don't think
not the head higher than the hips. The hips higher. I forget how I go. Hips.
What are you thinking, Natalie? I mean,
Okay.
Nate?
I'm trying to think, like, I don't think it was supposed to go greater than 90 degrees, maintaining the head of the bed at 60 to 90.
I'm thinking it's 2 too.
Maintaining the head of the bed at 60 to greater than 60.
Well, 90 is going to be that straight up right angle.
But then you're gonna be
60
putting pressure on
is
that
going to
hip.
be, in between there.
But the hips could be at 90 degrees though.
Sure they can. We sit in hip chairs all the time that are at 90 degrees.
Maintaining the head of the bed.
So
And we're talking
2.
about preventing dislocation. So we're talking about alignment measures.
Oh, so you're killing me.
Well, just pick one. If you're wrong, you'll be wrong now, right?
Yeah.
Which is fine. You be wrong now on test time, you got it.
I'm going with 3, but it's 2 or 3. But I'm gonna go with 3.
And what about you, Takesha?
I'm gonna take one for the team. I'm gonna go with 3 with her.
You like 2 though. 2
There you
was
go.
your
I
gut.
like 2, but there you go.
All right, now let's see this rationale.
Yeah, I gotta see. Oh, that's right. You put the buckles on, then you can turn them with the pillow in between. You're
All
absolutely
right, so
right.
you have to be less than 60 degrees to prevent excessive hip flexion, okay?
Mhm.
So it was good for you to go back and forth on that. I want you to understand that we keep that pillow in there all the time.
Gotcha.
All right, because we don't want that hip to go out of alignment when we're turning them or when we're doing something that might dislocate it.
Ooh.
All right, as soon as this recording gets straight.
So you got a big class coming.